41% of people in 2021 who died of an overdose died alone. There was nobody there to recognise. There was nobody there to respond. There was nobody there to call 999 or administer naloxone. So having an overdose rescue plan with somebody, having that conversation, it's never going to be a nice conversation, but if that conversation is had, it might just change something or put something in place that if somebody does overdose, somebody will be there to recognise.
Hello and welcome to the HSE Talking Health and Wellbeing podcast. Today, as we approach International Overdose Awareness Day on August 31st, we're shining a light on a topic that touches too many lives, drug overdose, and importantly, how we can all be a part of the solution. My name is Fergal Fox, and my guests today are Jenny Smyth from HSE Social Inclusion Department and Rob, who works with the Liffey Drugs Project in Dublin. You're both very welcome to the podcast.
Thank you.
Thanks, Fergal.
So this year's theme of International Overdose Awareness Day is community driven by hope. Jenny, can you give us an introduction to that from your experience?
Yeah, so each year there is an annual campaign to raise awareness of drug overdoses. And we try and remember those who've died without stigma and acknowledged the grief experienced by family and friends left behind. Each year then there is a sub-theme, and this year it is community driven by hope. So overdose doesn't just shatter a family, it fractures a community. In Ireland in 2021, 354 people lost their lives through overdose. Each one of those people is a person behind that number. They have family, they have friends, they have support workers.
Give us that number again.
354 people in Ireland in 2021.
Right.
So it's a huge number. And when you say that number and you think about everybody that surrounds that person, that's a huge amount of grief. And quite often that can be for people who've already had trauma from other loss as well.
So Rob, you're working with the Liffey Drugs Project here in Dublin. Can you tell us why you think this is important?
I just think overdose awareness, it's an important topic for everybody, as Jenny just said. People who pass away from an overdose, it affects a lot of people in the community, their families and friends. It brings more awareness to different cohorts of the community about the risks of overdose, how to prevent an overdose, how to react and intervene in an overdose, and also about how to talk about the risks of what can cause a person to overdose. And for an example, polydrug use, a person using multiple different types of substances, or a prolonged period of absence from drug use heightens the risk of overdose. So it's just about
airing some of those issues and highlighting some of that stuff, yeah.
Just bringing it to the forefront of people's minds, because as that statistic that Jenny just mentioned there, it's quite an alarming number.
Do you think this is a hidden issue?
Not so much now as it would have been maybe 10 years ago.
So there's growing awareness, but we need to keep pushing it.
Yeah, but there's growing awareness because more people, I think, are being affected by overdoses in the community.
And from your own experience, have you been involved or witnessed some issues around this?
Yeah, so I suppose over the last decade, the first overdose I would have intervened in was a fatal overdose, unfortunately, back in 2016 in Stephen's Green. I didn't have any knowledge about what to look out for in an overdose, how to intervene or how to respond. And for a while I carried a bit of guilt on that because I thought it was on me. But from participating in training and the Circle programme, which we'll talk about in a few minutes, I just didn't have the training or the awareness to know what to do. So I was able to overcome that and just work towards bringing my intervention skills.
So on the back of your training, have you been able to intervene successfully?
Yeah. 6 interventions successfully on my own, and then one with the help of the ambulance services. I used naloxone personally 6 times.
Oh my God, yeah. Tell me about that experience. It must have been incredibly intense.
Yeah, it can be intense. The most intense part is if the person isn't breathing. You're not putting them into the recovery position and you have to do CPR. That can get, as people see on TV, it's quite a traumatising, dramatic scene. Not just for the people involved, but for people passing by, for everybody that witnesses it. But I suppose the end goal is the preservation of life. So in the moment you put that aside and just push towards that end goal, and that is the preservation of life. So I'd put that paramount above anything, really.
Isn't that what it's all about, Jenny? The example that Rob is given there, using naloxone.
It is. And, when we're talking about naloxone, we gave the number of lives that have been lost. So opioids were the most common drug group that were recorded. So they accounted for 7 in 10 of those deaths. And 41% of those people were actually alone at the time of their death. And when we look at naloxone is a medication that will temporarily reverse the effects of an opioid overdose. But it can only do that if there's somebody there at the time who can recognise the signs of an opioid overdose and know how to administer naloxone and have naloxone there available. So a really key part of the HSE's naloxone programme is raising that awareness so people know how to recognise it, that they have naloxone and they're comfortable and know how to use it.
It's very, very important, but it's useless without that training. Basically.
Exactly. And if we look at a lot of medications, you can administer those yourself, but with naloxone, you can't. So if I'm prescribed naloxone and I overdose, I need somebody else to recognise. I need somebody else there who can use naloxone on me.
Yeah, and one of the other things I just want you to pick up, Jenny, Rob mentioned that he, witnessed an overdose that he couldn't help out on. That kind of reminds me of that network of trauma that's created by an overdose.
It is.
Like even the witnesses.
Absolutely. And if we look, about 70% of people who use drugs have witnessed an overdose, and whether that is fatal or non-fatal, that's a huge amount of trauma for that person to take on board.
Yeah. So tell me more about naloxone. How long has this been available in Ireland?
So it's actually been available for 10 years this year. So the naloxone demonstration project was started by the HSE and driven by Dennis O'Driscoll. It was a naloxone demonstration project. So it started in 2015 with 600 units of prenoxide. So that's the injectable naloxone. And when we compare that to now, so 10 years on, last year's distribution of naloxone was 6,944 units. So it's gone from a demonstration programme to an actual programme that's continuing and continues to expand. So last year, naloxone was used 438 times. And when we look at that, we can say at least 17 lives were saved from naloxone use last year. Now, when naloxone is used, we ask people to share that use, the data for that use with us. So obviously not all of those uses are shared with us. So we can only report on the ones that are shared with us, but 17 lives just last year.
Wow, that's a lot of lives.
Yeah.
Rob, can you tell me, you mentioned the Circle group there in Liffey. Can you tell me a bit more about that?
Yeah, so it's the Circle program. It's a peer-to-peer overdose intervention group, basically, where peers are trained to talk about, spot the signs and risks of an overdose, respond to an overdose, both if a person's breathing, not breathing, and then how to talk about it afterwards. Because if a person survives an overdose, they're at a heightened risk after an overdose, first of all. And secondly, they're going to be traumatized too. So it's important to be able to talk about the overdose after it happened. So it's just about being able to provide that support both before, during and after the overdose.
Right, I didn't think about that, the impact on the person themselves afterwards. So they've had a near-death experience. They're traumatized and they need to be spoken to and supported, or some level of intervention there in that sensitive time.
Yeah, I mean, people could be signposted towards additional support services, talk therapy, counselling. In the Liffey, we have a stabilisation programme, which my colleagues run fantastically. It's a very good group that I've helped facilitate a number of times. Jenny mentioned something there about when naloxone was first kind of rolled out for the introduction or trial phase 10 years ago, and 600 units being issued. And now there being 6,000. So I would be a part of the team that does the needle and syringe program in the Liffey. So we have a mobile...
It's the exchange program.
Yeah, needle exchange. So on a Thursday morning, due to a lack of other needle exchange facilities, because one closes just for staff training or whatever on a Thursday morning, we provide a mobile needle exchange program. And in that, in the last 6 months since I started with the Liffey on placement, I've noticed the amount of people asking for naloxone has increased drastically. They're coming to us. It's not just us saying to them, would you like to take nasally administrable naloxone with you? They're approaching us.
Okay.
So I think now with the likes of the Circle program, we can say, here's naloxone, but would you like to learn more? Would you like to know more?
Well, that's great. So you can see, and literally through that outreach program, you're witnessing the change of awareness and the change of behaviour from the target group, saying they're actually asking. That's interesting, isn't it?
Yeah.
And you mentioned nasal. So how was this taken?
Yeah, so originally when naloxone launched in Ireland in 2015, there would have been one type of naloxone. So that was an injectable, but a pre-filled syringe, and people who know it would see it as the yellow box. After that, then there's been 2 additional naloxones that are now available, both of which are intranasal. So it's literally a nose spray. You pop it into somebody's nose and you press it. It's as simple as that. So there's 2. We have Nixoid and we then have Ventazolve.
Right. And they're all the same effectiveness?
Yeah, they're all naloxone. They're just in different forms. But when we look particularly at the community, nasal is easier to use than somebody having to assemble a needle and inject somebody with naloxone. You can actually just use a nasal spray.
Yeah, it sounds obviously less invasive.
Yeah, more user-friendly.
Yeah. So let's come back to overdose and the other issues. You know, we're talking about obviously naloxone there and as an intervention, and the awareness and engagement with it is increasing. That's very positive. But let's go back to the issues around overdose And what would you see as well as kind of raising awareness in naloxone? What do you see as the other key issues around overdose awareness, or what are the important elements?
For me, and I think, Rob will say, it comes as a really key part of the Circle peer-to-peer overdose prevention programme. It's that prevention of an overdose. So if we can make people more aware of the risks, and quite often if somebody is using drugs, they don't take time to sit and think, well, actually, am I at high risk of an overdose? So have I had reduced tolerance, for example? Have I been in prison? Have I been in hospital? Have I been in a drug treatment programme where I've been using less or not using at all, in which case I'm at higher risk? And also then, as Rob said, polydrug use. So thinking about using more than one type of drug increases your risk. But that's not just illegal drugs. So that's prescription medications, that's alcohol, anything particularly that's a depressant. More than one is going to increase your risk of an overdose. The peer-to-peer overdose prevention programme is focusing on looking at those to try and help people prevent getting an overdose in the first place. And then if they do overdose, how then to recognise and respond to it.
Yeah, and Rob, your work with the peers and educating them around those risks, what's the response from them? Are there things that they'd be surprised by, or do you think with people that have experience with drugs, are you kind of changing the game for them with this?
Well, the people who participated in the Circle programme, they wanted to participate. They were well aware of what the programme entailed. So I believe that they had the same goal as myself, the preservation of life.
So they were motivated already?
Yeah, they were motivated already. One member of the group was working in another service. 2 other members of the group were just normal people.
People that use drugs?
I can't say for sure, but they're just people that I was in a group with. I don't know if they were service users or not, but they were people who could have been friends with somebody that used drugs or family members.
So they could see this skill and this information is going to help them and their network?
Yeah, definitely, because overdoses are, like, people see it on the internet, people see statistics and numbers coming out, and then as Jenny said at the start, if one person overdoses, probably 10 or 15 people are affected by that if it's a fatal overdose. And if it's a non-fatal overdose, because as I said, it's equally as traumatic.
Yeah, so the friends and family members and community associates.
They absolutely are. It's not just a one-person response. You need people, a circle around you to be able to support. And I think when we're talking about how we support people as well, we've moved this year into providing overdose awareness and naloxone provision to people who are in residential drug treatment programmes as well. So these are people whose tolerance has been lowered because they're not using at that time, or they've been stabilising. So when they come out of that treatment, they are at high risk, but also providing training to their family members who are supporting them while they're in that treatment programme as well. And when we're talking about attitudes changing, that would have been something that would definitely have been a no-no. If you've gone into treatment, you don't need to have that information, but people are realising that that information is key, not only for the person who's coming out themselves, but also for that person to be able to support their community when they come out, because they may witness an overdose in the future.
Yeah. That's really challenging, if you're going through rehab and you've been told this is a risk for you, isn't it?
It is. And people saying, originally it would have been, no, I'm not taking naloxone, I've gone through this treatment programme. But it's the fact that unfortunately not everybody is successful in that treatment programme. So if naloxone and awareness is rolled out for everybody as part of that programme, it's not an indication as to how you're performing with your own recovery. It's for everybody as a blanket, and it's a support as a community for everybody.
Yeah, no, that seems very smart.
There's just one thing that I found that was very informative, I suppose, in the Circle programme. A lot of people have a misconception, I suppose, that you can only have an opioid overdose from street drugs like heroin. But unfortunately, that's not the case. And I think that's with the amount of prescription opioid medications out there and adulterated substances mixed in with what people think they're buying as heroin. It's bringing more awareness that it's not just heroin that can cause an overdose. It could be prescription medication for pain like tramadol, codeine, even some prescription cough bottles had codeine in it up until, I suppose, recently enough. And yeah, like the adulteration stuff that's being mixed in with heroin definitely increases the risk of overdose. So it's just bringing that to people who would traditionally associate overdoses with just heroin, bringing that awareness that it could also happen from prescription medication.
So Rob, you were telling me about the peer circle group earlier on. Do you think that's going to grow as a concept?
Yes, so I had been approached by a course coordinator in one of the further education and training colleges here in Dublin, because they're aware of my role following my placement in the Liffey and that I've continued to work with them. They had asked me if I could see a possibility of the provision of naloxone training or the Circle programme, which I think would be better because there's more in it. to the social care students in the college, because so many people that study social care go on to work in addiction services. And yeah, I think we're going to try to see if we can facilitate that.
And I think that's one of the big changes as well. You know, it would have been us knocking on a lot of doors. Now it's people coming to us to go, actually, can we now roll that out in our area? We are rolling out an additional circle programme in our first inpatient residential treatment. So we've provided naloxone information, overdose awareness within the treatment programme, but this will be the first time that we've done a peer-to-peer circle programme within a residential treatment. So it'd be really interesting to have the feedback from the residents from that one. And I think we should just mention that the circle programme was very kindly given to us. The programme was given to us from Novus. It was their TOPL programme, and they very kindly allowed us to adapt it for national rollout.
There's so many different types of substances out there, and you're trying to educate people that are using drugs, you know, to be careful, but that piece is always changing. So is that a very difficult place, Rob, when you're trying to encourage people to the HSE social inclusion message, start slow and go slow? You don't always know what you're taking.
Yeah, I suppose when somebody that's using drugs is buying a substance off the street, they don't know what's in them. And as Jenny had mentioned, we had that bit of a crisis with the nitazines, the synthetic opioids that are mixed in with heroin, street heroin. And they are hundreds of, probably thousands of times stronger than what the person would be used to taking. And it's a near guaranteed overdose. Their bodies can't tolerate it. So yeah, I think not just traditional heroin, but also adulterated heroin with the synthetic opioids and prescription medication. They're all within the bracket, I suppose, of substances that could cause an opioid overdose.
And when we're looking at those, sometimes people would hear when they're purchasing it that it is stronger or there is something slightly different about it. And what we would encourage is if somebody has got a substance like that and they know they're going to be taking it and they are aware that it might potentially increase their risk of an overdose, particularly then if they are able to get to the injecting facility where they will be medically supervised. So if they do experience an overdose, the staff there are trained to be able to support them. And that support isn't going straight into naloxone, because obviously naloxone takes the opioid away, so that person is going to go into withdrawal. The team in there will provide support initially with oxygen to try and support that person, and naloxone will be the last resort for them.
There's a lot of listeners that would have seen examples of overdose through movies or through Netflix series. The drug examples that they maybe have witnessed through their television are very
American-based.
Very American-based. Is that fair? We have a very different experience here.
We do, and hopefully that experience remains very different. So if we're looking at America, they are in an opioid crisis. They have a lot of fentanyl. Here at the moment, you know, it would mainly still be heroin. There are some synthetic opioids in terms of the nitazines, but I suppose American situation is quite different from ours, and we would certainly hope that it remains that way.
I suppose also in the States there was an over-provision of opioid-based medications as well that would have made the opioid crisis over there a lot worse, like OxyContin or as we call it here, Oxynorm.
Yeah, and that's been highlighted a lot recently, isn't it? What's that scene like? You know, Rob, you're talking about synthetic versions and things being put in with different drugs. I mean, that must be very confusing to keep up to date with that. How do the HSE and projects like Liffey, how do they keep on top of that?
Yeah, so I think it's particularly if we look back to, would have been November 2023, which would have been the emergence of synthetic opioids, the nitazines. And I think my colleague Nikki Killeen and Professor Eamon Keenan would work very closely on looking at the emerging drug trends with the service providers and being able to look at that. People who are buying substances on the street aren't going to know what the contents of those are. And it is being aware that, you know, it may be a nitazine or it might be something stronger, but also then it might be a drug that's been mixed in something else. So you're not aware that you're taking that at the time. So it really is raising that awareness as to if somebody doesn't look right, call in for help.
Yeah. The awareness of people that use drugs around the dangers. I know, like, it seems generally dangerous to use drugs, but that the danger in not knowing and different levels of substances been sold as different things. Has the awareness grown at that, Rob, do you think?
I think it has, yeah, definitely. I mean, back in that time period there that Jenny just mentioned, there was a lot of, especially with the Liffey, people came in at the weekend just to basically go out and tell all their clients, look, this is going around, be careful. I do think that response did save lives.
When there's a risk identified, that information is shared very broadly.
Yeah.
And it's the partners all working together. And I think particularly now if we look, so at the end of last year, the supervised injecting facility opened in Merchants Quay. So again, it's looking if there is an increased number of overdoses in that location, can that communication be shared so that other service users are aware?
Yeah. So communication and awareness, it's live all the time. There's issues emerging all the time, isn't there?
There is, and it's about people being up to date with that information, but also having that information from trusted sources as well. So if you have somebody saying that there's a substance out, checking whether that is correct before you're sharing that information around.
Very good. So in terms of what everybody should know in relation to overdose, we're talking about the people in the network, like broadly speaking, like we're talking to the public here. What message, broadly speaking, do we want for the public around overdose, as well as people that are going to be coming into contact with?
So for me, it really is being aware of what the signs of an overdose are. So if you're looking and somebody is unresponsive, if they're shallow or they're not breathing, if they've pinpoint pupils, if they've pale or clammy skin, if they're snoring or there's a kind of rasping, rattling sound, and then if somebody has white skin, if the lips or nails have gone blue, or with black skin, it's going to go a greyish tinge. So if you're seeing some of those signs, that you are calling 999 112, asking for help. But if you have naloxone available, that you do administer it. And when you're calling 999, that emergency operator is going to talk you through how to use that. So if you've never used it before, but you see the person has it, tell the operator you have it, because they'll tell you how to administer it.
Does that happen?
That somebody,
just talking through
the 999 call holder would talk you through it. But if you think even in terms of from a staff perspective, if we train support staff, you're not a medical doctor. So if in that occasion you freeze, you can't remember what to do, that's okay. We're all human. The call holder will tell you and remind you those steps to follow, how to administer it, how to open the packet, how to spray it, for example.
Yeah, it's great to have that service. Is so valuable, isn't it?
That reassurance, absolutely.
So Jenny, we started the podcast asking about the theme of hope. Talk to me about hope in this context.
Yeah, so you can't just have one action. It can't just be all of the peers that are able to focus on this to be able to reduce overdoses and fatal overdoses. It needs to be a community-driven response. So when we're talking about communities, we're talking about peers, we're talking about family, we're talking about friends, we're talking about community support services, mental health services, in the prisons, the community within the prisons. So it's a whole wide community that we're looking at. And we are one community. We all share in that pain, but we all share a choice and actions that we can do next to be able to prevent it and lower those deaths. So as a community, we can take the choice to learn how to recognise an overdose. We can take the choice to know how to respond. And we can also have that choice within a society that we have naloxone more available so that we can use it if somebody needs it administered.
And should we acknowledge that can be very challenging for the community around the person or the family and friends around somebody that's using drugs? It can be a challenging space.
Absolutely. And you may have that person who's telling you, I'm not taking a substance, but as a family member, you know they are.
Yeah.
So having that naloxone there available so that you're able to support your family member. Naloxone is an amazing product. So to be able to administer something while you're waiting for that ambulance to arrive that can temporarily reverse the effects of an opioid overdose is really empowering for somebody.
Yeah. Did you think when this came in initially 10 years ago, what was the attitude early doors?
So I'm in my role the last 3 years and I've seen the change over the 3 years that I've been in my role. You'd have knocked on somebody's door and they'd have said, no, naloxone isn't for us. But if you get one service or one area, okay, we'll pilot it, we'll trial it. And it changes that attitude. And if somebody can see actually it has been beneficial, somebody else will then trial it. So if we're looking, say, for example, at the residential treatments, the first residential treatment we went into and provided that training, somebody has to start it. And then you can see, did the people find it beneficial in there? But did the service see that beneficial side of it? So now the next element is we'll be going into the hostels. So providing training within the hostels. So meeting people where they are. So we're not always looking for people to go and find that support. We will go to them and we'll provide it.
Having people that their lives are saved. Like there's nothing stronger than that, is there? Like that's
peer to peer.
That's the ultimate message of hope, I think, is save lives.
Yeah.
A positive result from an overdose is that that person now has hope to go on and hopefully live a substance-free, hopefully, or a harm-reduced life.
Yeah. And the harm reduced, this is one element of a broader harm reduction policy that we have in Ireland now in relation to substances, isn't it?
It is. So we have the government's Reducing Harm and Supporting Recovery. So that's the 2017 to 2025 strategy. So it's to look at minimising the harms caused by use of substances, as well as promoting rehabilitation and recovery. So there is a commitment from the government to continue expanding the availability of naloxone. But naloxone does, as you said, sit within a wider piece. So it includes addiction support services, treatments, care plans, recovery, and also additional harm reductions. So at that, we're looking at needle exchange, as Rob was mentioning earlier, crack pipe provision, the supervised injecting facility, And then also back of festival, back of house testing of drugs. So naloxone is just one part. Naloxone isn't the fix, it isn't the cure, it sits within a wider programme of supports.
Yeah, gee, that's a really comprehensive range there you just mentioned. You just flew through it there, but there's so many big programs going on, isn't there?
There is, and we're just one small part that sits within that.
So Rob, I suppose from your point of view, working in the Liffey Project, you can see people need different things at different times.
Yeah, and that would be one great thing I can say about the Liffey Project and my colleagues is that we try to meet people at where they're at, be it they're in the throes of addiction or they're after coming out of treatment and are just looking for some support around their continued recovery. That would be one of our primary goals, is meeting people at where they're at and harm reduction, like we were just mentioning.
So you need to be really patient as a service then and supportive on an ongoing basis.
I don't know if patient is the word, but empathetic, non-judgmental, and letting the person feel comfortable. Okay, they could be going through the worst time of their life. They don't need somebody, I suppose, drilling that home. They just maybe need somebody to listen to them, or somebody to talk to something about, or just a little bit of guidance in the right direction. But yeah, there's people that come in, different service users come in for different services. And there's always people at different stages of recovery. And also part of recovery is relapse.
That's real.
That's real. And that's, as we were mentioning with the risks, when somebody relapses, they're at a higher risk of overdose because they've been away from taking the substance, so they have a lower tolerance.
Yeah, that's so sensitive. It's such sensitive stuff you're dealing with here.
And I think we can look at the numbers and we can think we know everything, and then you go and speak to somebody else. They have a completely different story, and again, they need completely different supports.
You mentioned earlier on, we were talking about the communications, that the partner agencies are essential at kind of building the knowledge. We had Nikki Killeen on one of our first episodes of the podcast talking about that, the harm reduction and trying to find out about the drugs at the festivals and some of the outreach that they're doing around the nightlife. So it seems to me that, you know, the synergy between the intelligence gathering and the outreach and the support, that alignment of the partners is one of the key strengths of your overall strategy.
It's vital. Because particularly if we're looking at overdoses, I suppose that's what we're here talking about today, you know, we need to be able to know, is there something happening in the city? Is there extra risk? Are there additional overdoses? But also working with the ambulance service, the Dublin Fire Brigade, so that all those services can support together. And then again, those partner communications so that they can go out to the people on the ground, because, you know, people aren't necessarily watching the news or checking their phone. It's about having that conversation between people. But it's that information going back and forth between the partners so that that can move forward and all support each other.
I want to make a few calls to action here for different people. You were telling me about the important HSE land training. I know Social Inclusion have a couple of very strong HSE land trainings online. So what would you call out to health service staff or people working in the social care arena?
So if we're talking about staff, what we would ask them to do is to go on to HSE land. So every staff member would have access to HSE land, whether they're directly for HSE or they work for a partner service or they're a volunteer. So once you're on there, you can just put in the search naloxone and you'll find the overdose prevention and naloxone administration training. It's going to take about 45 minutes and you can go through each of those stages within that and also watch the 2 demonstration videos.
And that takes you through those risks that you highlighted earlier.
Exactly. So it'll take you through the risks. It'll take you through how to recognise, how to respond, what naloxone is, how to use it. And I suppose one of the key things there is, you know, naloxone is going to last 20 to 90 minutes. It's temporarily going to reverse the effects of an overdose. It's not going to get rid of the opioid. It just temporarily removes it from the receptor within the brain. So it's about getting that 999 help. It is only temporary. And then if we're looking at people who don't have access to HSE land, going to either the HSE naloxone webpage or the drugs.ie naloxone webpage, and watching those demonstration videos. We do have QR codes, for example, on posters outside of the prisons that bring you to those videos as well, because those short videos show you how to recognise, how to respond to an overdose.
You have the posters outside prisons, because that's a key.
We do, yeah. So we have the posters, they're outdoor banners outside each of the prisons, and they have a QR code because people who are experiencing an overdose themselves can't respond. So those posters are vital for visitors to be able to see them. We did have a piece of street art on Parnell Street as well, again, with the QR code. And we would try and get as much information as we can so that people are more aware.
Okay, so we'll put those links in the podcast information. Wherever you're listening to this, go into the podcast information. We'll have those links there that Jenny's talking about. Is there anything specific for any other group of staff that you'd like to call out?
staff, it's also peers as well. So if we have peers listening, or we have somebody who's supporting somebody who's at risk of an opioid overdose, having that conversation. So when we're looking back at 41% of people in 2021 who died of an overdose, died alone. There was nobody there to recognise. There was nobody there to respond. There was nobody there to call 999 or administer naloxone. So having an overdose rescue plan with somebody, having that conversation, it's never going to be a nice conversation. But if that conversation is had, it might just change something or put something in place that if somebody does overdose, somebody would be there to recognise.
And that would have been one of the key topics that we would have discussed in the Circle programme, is having an agreement in place with somebody that you perceive to be at a heightened risk of an overdose. So say, for example, as Jenny mentioned, a high percentage of people that had overdosed had used alone. So about making that agreement with somebody, when I said to you about the before, during and after.
Yeah.
So in the before, you could say, Joe Bloggs, I'm concerned that you've changed your method of administration. You were smoking before, now you're injecting. I'm concerned if you're on your own, you might have an overdose and there mightn't be anyone there to respond. If you're considering using that way, would you give me a ring?
Okay.
So I know if I don't hear from you in 10 minutes, or if you want me to come down and be there while you're using it, and just in case you overdose, that I'm there to administer naloxone.
So there's harm reduction conversations going on and integrated into that thinking.
Yeah. It's all about the ability to prevent an overdose
and
having a proactive instead of a reactive response.
Okay, great. Thanks for that insight, Rob. I think it's important to acknowledge, like, you're talking about so much sensitive stuff and the issues that you're highlighting, the people that are use drugs are experiencing themselves. They may be coming from trauma, and the experience of overdose is obviously traumatic to themselves and the network, like we mentioned. But when somebody loses somebody, I think it's very important that we acknowledge loss and grief today. It's such a really sensitive topic. We could have listeners here that have lost somebody. And just like you said earlier, Rob, that you've witnessed somebody dying by overdose, it's incredibly traumatic.
It's hard. It's difficult for everybody that's involved, family, friends, the person that's at the scene of the overdose. It's okay to grieve. That's understandable. It doesn't matter if it's a family member you haven't spoken to in a couple of years because of their behaviour or substance use. They're still a loved one. They're still a person. Whether someone's using drugs or not using drugs, at the end of the day, it doesn't matter. They're a person. And their family are people with feelings. And I just think now that there's less stigma and less judgment around people who are using drugs, the community can rally around and support families who have been affected by a fatal overdose.
That's very important.
It is very important, yeah, because there's so many stakeholders in the community now that can be affected by an overdose.
Yeah.
People don't know when an overdose is going to happen, where it's going to happen, and who's going to overdose. So the more people in the community and the more family and friends that not only are aware of what's going to happen before and during and after an overdose, but also just to have the empathy to talk to people, listen.
Support the grieving process. Be a part of the grieving process. And sometimes after the fatal overdose that I tried to intervene in, I'd speak. I know their family. Yeah.
So yeah, it was a very traumatic time for them. They still grieve to this day. They still come up from the country to Dublin on his anniversary. He's remembered every year. He's remembered right now as I'm discussing this. And I guess, as Jenny said at the very start of the podcast, it's just about remembering the people who've lost their lives and what can we do to avoid that in the future.
Yeah, it's so powerful. Okay, Jenny, is there anything else you'd like to highlight before we finalise this episode? We have touched on a lot of important topics.
Thanks for the opportunity. As we said, International Overdose Awareness Day is on the 31st of August each year. This year, the HSE will be hosting a live webinar on Friday, the 29th of August from 11 till 12:30. You can join that if you go on to the link that you'll add into the chat. Dr. Dennis O'Driscoll will be hosting it, and we'll be listening to different elements of the community talking about the actions that they're taking to try and prevent overdose. So we'll be listening to Ishka, we'll be listening to Merchants Key Island, we'll be listening to the HSE, and a Liffey Drugs Project, Peter McVerry Trust, and also the Irish Prison Service. So as you can see, across a wide variety of the community and how everybody is all working together to try and reduce deaths.
Okay, so and if you're listening to this podcast after the 29th of August, when that webinar is been hosted, it will be available as a watchback option, won't it?
Will. So it'll be recorded on the day and then it'll be available on the drugs.ie International Overdose Awareness Day 2025 page.
Okay, and again, we'll give the link to that page in the podcast information. Jenny from HSE Social Inclusion, Rob from Liffey, thank you so much for coming in today and sharing your insights and expertise in this very sensitive and complex area. I really appreciate your participation in the podcast. To the listeners, as always, please share the episode with anyone that you think might get value out of the episode. If you want to get in touch with us here in HSE Health and Wellbeing, you can email healthandwellbeing.communications@hse.ie. And thanks for listening to another episode of the HSE Talking Health and Wellbeing podcast.